Hi, Assalamualaikum. My name is Muhammad Danieal Yusof. The case study that we are about to discuss is about the Falls Church General Hospital or FCGH, which was located in Virginia, USA. It cannot be denied that quality healthcare is a goal to all hospitals, but only few have developed comprehensive and scientific means of asking customers and patients on how the quality of care they are serving. The boards of FCGH believe that all hospitals need to make transformation from the standardized quality assurance to measure and improve the quality of care received by patients from externally, customer perspective, and internally. Then, they thought that accurate information about how the customers and the healthcare professionals judge the quality of work in the institution is mandatory. Then, the main value of survey is to gain quick knowledge of problems faced by the customer. Afterwards, Merrill Walkerton, staff director at the institution, had an idea after he read a book that wrote about quality at TRW, which were a big manufacturer. There are 14 steps in TRW's quality audit which are deemed to be a success in quality control and improvement.
Assalamualaikum warahmatullahi wabarakatuh. My name is NURFATIN ZULAIKHA binti ZAMZURI. Today I would like to present about hospital measure quality. Hospitals are able to measure the quality of care that they serve, but it might be a complex thing to do. However, there are a simple indicators that helps most hospitals on deciding if the quality provided is either good or bad. The most important signal is on the patient outcomes and their experience on the hospital. This would seem useless, but it could tell the quality provided by the hospital is on the same level of its reputation. Another way to measure quality on a hospital is to check the survival rates or standard mortality rates. This is to look on how much percentage of the patient on the said hospital survive and able to live normally afterwards. Either ways, hospital can gather customer feedback through surveys or other methods to know their work and care quality.
Hi, I'm SYAFIQAH. I will answer question 2. Question 2 asks, why is it important to get the patient assessment of healthcare quality? And does a patient have the expertise to judge the healthcare he or she receives? Okay, the answer. Patient's assessment of healthcare quality is crucial in the continuous cycle of work in the hospital. Patients receive the service that hospital provided, thus they should obviously know whether the care is being the best or the worst in the market. This could indicate whether the results of the service meet the patient's expectations. Out of many important factors, there are two that are the utmost important, which is patient preference in terms of care and also his convenience. No doctors or nurse know their care is good except the patient himself. Thus, the patient point of view regarding the care cannot be neglected and must taken care of.
My name is ZAHIRAH binti AZAHA. Today I want to present about question 3, which is the value of human life be included in the cost of quality control. The answer is life is a complex thing to explain, and human life is much of greater value, and its value should be included in the cost of quality control. While preparing the cost of quality control inside the hospital, it is also important to see on how they will affect the human life. It is to differentiate whether the increased cost of quality control can help in prolonging the human life or worsen it. Next, it is undeniably important to factor their impact to see the result of the quality control. We expect for returns and beneficial outcomes and avoid hazard and harmful conditions to the patient health. Thus, investment in quality control shall be made on basis of the effect on human life, and accordingly, the cost will be calculated.
My name is HAZAINI binti AZID. Let's discuss question number 4, which is customer survey used to evaluate the quality of teaching. The answer is, without that, there are certain parallel between the evaluation of healthcare that is done on a majority of hospitals and the evaluation of educational quality across all education institutes. First of all, students are also like patients. Their well-being must be observed and cared by to nurture mutual understanding to do best in the service provided. By having mutual understanding or bond, patient and student alike are able to be bonded, thus able to know their weakness in education or illness in healthcare. They both share the same thing, which is they provide service to people that needed it. Hence, they need identical strategy to improve the quality of the service they are offering. The quality of education are evaluated mostly by survey or questionnaire that are given to students at the end of semester. This is to collect data on how much students have gained knowledge and improved their study. If the results collected are not as expectation, education institutes are able to pinpoint the major weakness and improve it. There are other measures to assess educational quality, such as we could look at the graduate rate of students and also their grade by each semester. The improvement that I would suggest in current system is to correct the marking system that are not unified or elegant between different educators. This could result in conflict and misunderstanding between student and educator.